I'm Dr. Neneman with Neneman Chiropractic Clinic, and today I'm going to talk to you about the sciatic nerve and its correlation with hip pain. I have a lot of patients present to my office with either left or right hip pain or pain in both hips, and I've seen that a lot of times they're told by other physicians that they have hip bursitis, which is inflammation of the bursa in the hip, and a lot of times this isn't the case. Most people have heard of the sciatic nerve. I think everyone, most people have heard of it, and I think, a lot of patients with any kind of back pain, they say, oh, my sciatic's flared up, and a lot of times they could be incorrect. It's not the sciatic nerve, it's another area in the spine or another joint, but oftentimes it is a sciatic nerve. And just to go over the sciatic nerve again, in the lower back, the lumbar, and in the sacrum, which is the tailbone, so I often just say lumbosacral to combine the two, but the lumbosacral nerve roots exit on the left and the right side of the spine, and those nerve roots kind of like a web come out and they form together to form one big nerve called the sciatic nerve, and that runs down the glute and down the back of the leg all the way down to the foot, and as it goes down the leg it does have some other branches that come off of it, but that's on the left and the right side. And that as that nerve goes down the back of the glute and down the back of the leg, it is in close proximity to the hip. And what I have found is when those nerve roots are irritated and causing that inflammation down into the sciatic nerve, it will refer pain into or around the hip. And so, as a physician, it can be kind of tricky because that's what you have to diagnose. Is you have to differentiate: is this a hip problem or is this a nerve root or sciatic nerve problem? But again, if you are having hip pain, there is a good chance it's actually coming from your lumbosacral nerve roots, your lower back nerve roots, or the sciatic nerve, where the big nerve that goes down the back of the glute and the leg. So, that's something. If you're having hip pain, you should definitely see a chiropractor and to get that figured out, whether it's coming from the hip or the lower back. But again, I've seen it misdiagnosed before. I've had patients get hip injections in the bursa for bursitis when in reality the problem is coming from the nerve root. So again, something that needs to be differentiated, because by doing chiropractic adjustments on a patient with those symptoms, you can a lot of times find that the hip pain resolves when you start treating those lumbosacral nerve roots. So anyway, if you're having that condition, make sure to give us a call. We'll get you checked out and get to the bottom of it. So thanks for tuning in today, and join us next time for another great topic about chiropractic. Thank you.